My name is Dr. Michael Zachariason. I'm an allergist and immunologist from Bozeman, Montana. I work at Family Allergy and Asthma Care of Montana, caring for patients with allergies, asthma, and anaphylaxis. The presentation today will deal with anaphylaxis readiness in Montana schools. This program is sponsored by the Montana Asthma Advisory Group at the Montana Department of Public Health and Human Services. I will be your presenter for this program. Let's begin with some overviews and objectives of today's program. We will be discussing anaphylaxis in particular for school personnel and school nurses, as there have been changes brought about by the stock epinephrine law. There's a need for education about anaphylaxis in our schools, both public and private. I will talk about the 2013 stock epinephrine law, and my goal is to provide training so that there will be authorized personnel in schools to administer epinephrine in the event of an allergic emergency. We will review the early signs and symptoms of anaphylaxis. I will review the indications for administering epinephrine. There will be a video demonstration on how to administer an EpiPen and the AviQ device. And we will review the need for immediate access to emergency care, including calling 911. Another aspect will be a brief protocol that schools may use as part of their emergency plan in dealing with anaphylaxis emergencies. And then finally, I will review a program that offers free EpiPens for schools. So what is anaphylaxis? Anaphylaxis is a systemic allergic reaction that can be fatal in a short time period, and it is also known as anaphylactic shock when blood pressure drops. Anaphylaxis is a clinical diagnosis. There is no specific test to make the diagnosis. It can be rapid in onset, unexpected, and may lead to death. The early signs of anaphylaxis can be mild, but they may progress. Symptoms typically become evident within a few minutes, but they may begin up to 1 to 2 hours after the exposure. Each reaction may be different, and different for different persons. Also, different routes of exposure can lead to anaphylaxis, be it an oral ingestion, such as a food or medication, or an injection, such as an insect sting. So what are the symptoms of anaphylaxis? They can affect nearly any body system, especially respiratory. These symptoms can appear just like asthma, with sudden difficulty breathing, cough, hoarseness, wheezing, shortness of breath, or even chest tightness. Cardiovascular symptoms, which can be extremely severe, include pale blue skin, a weak pulse, dizziness, low blood pressure, lightheadedness, and even loss of consciousness. About 90% of all anaphylactic reactions involve the skin. This includes generalized hives, itchiness, flushing, and rash. Frequently, there are gastrointestinal symptoms, including nausea, vomiting, cramping, diarrhea, and acid reflux symptoms. Facial symptoms may be noted immediately, including swelling of the lips, change of the voice, tongue swelling, throat swelling, difficulty swallowing, and even a metallic taste in the mouth. And then finally, there are some other symptoms which can be quite specific for anaphylaxis, including this feeling of impending doom. The patient may appear nervous and agitated. Now, there are many different allergens that can trigger an allergic reaction, but this slide demonstrates just a few of the ones that are the most common. Food allergies. About 1 in 13 children has a food allergy. About 90% of all food allergies are included in this list. Peanuts, fish, crustacean shellfish such as crab, shrimp, or lobster, tree nuts, soy, wheat, milk, and eggs. Other allergens include insect venom. This would include usually yellow jackets, wasps, and hornets. On occasion, exposure to animal dander can trigger a severe allergic reaction. Latex allergy is an uncommon trigger of anaphylaxis, but it can be severe. And finally, medications. Typically antibiotics or aspirin-like medications can trigger severe anaphylactic reactions. Let's move on to the treatment of anaphylaxis. Currently, there is no specific treatment available to prevent anaphylaxis from occurring. So the management is directed at 1. Identifying and avoiding the allergen. Number 2, early recognition of symptoms of anaphylaxis. And number 3, rapid treatment with epinephrine, which is the drug of choice for severe reactions. There are various risk factors for developing anaphylaxis. The first is if you've had a prior history of an anaphylactic reaction. Another significant risk factor is asthma. Delay in administering epinephrine can significantly increase the risk of a poor outcome. The reliance on antihistamine is another risk factor. Peanuts and tree nuts are the most common cause of anaphylaxis in the U.S. and therefore a risk factor. And finally, denial, particularly in adults and adolescents. The failure to seek treatment immediately can increase the risk of a poor outcome. So what are the indications for administering the epinephrine? Essentially, severe symptoms from any of these organ systems as seen on the slide would be an indication for administering epinephrine. Those severe symptoms, as we outlined previously, would include lung symptoms, heart symptoms, throat, mouth, skin, gastrointestinal, or that feeling of impending doom, anxiety, and confusion. In addition, any combination of 2 organ systems, even if the symptoms are mild, is consistent with an anaphylactic reaction and an indication for administering epinephrine. It is a common belief that antihistamines would be sufficient to prevent a severe reaction. But this slide, I think, helps demonstrate that epinephrine, rather than antihistamines, are the medication of choice. In this study, antihistamines were administered, and the time to suppress the wheal and flare of the histamine response was measured. In other words, how long does it take to suppress the histamine reaction by 50%? The bar on the left shows fexofenadine takes over 100 minutes to suppress histamine at 50%. But most people don't use fexofenadine to suppress allergic reactions of this extent. Benadryl, also known as diphenhydramine, when given orally, can take up to almost 80 minutes to suppress histamine 50%. Even intravenous administered Benadryl can take almost 52 minutes to suppress histamine. This is much too long to treat or prevent an allergic reaction. In contrast, this slide demonstrates how quickly epinephrine, when given intramuscularly, will work. The onset of action is within minutes. The top half of the slide demonstrates changes in blood pressure, and one can see that the blood pressure increases within 5 minutes and then returns back to normal by about 15 minutes. Similarly, the heart rate will have a significant increase within 4 to 5 minutes and returns to normal within about 15 minutes. This rapid onset of action is the key to treating severe allergic reactions. So epinephrine is our first line of treatment for treating severe anaphylactic reactions. Epinephrine is available as an auto-injector, and there are currently 2 major devices available on the market. The AviQ device is one device used for treating severe anaphylactic reactions. AviQ stands for audio-visual cues. It comes in 2 dosage strengths, just like the EpiPen device. The EpiPen device, which has been available for about 25 years, is also a common device used for self-injectable epinephrine. Let me first demonstrate the use of the AviQ self-injectable epinephrine. This device has audio-visual cues, and it will speak for itself.
This trainer contains no needle or drug. If You are ready to use. Pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Next, I would like to demonstrate the use of the EpiPen for you. The EpiPen comes in 2 different strengths. The EpiPen 1 to 1000 dilution, or 0.3 milligrams, is designed for children over 66 pounds. The EpiPen Junior is designed for children between 33 and 66 pounds. This trainer does not have a needle or active medication. It's very easy to use. The instructions are on the trainer, which comes with the prescription. To use this device, clench it in your fist. Do not put your fingers or anything over the orange part. This is where the needle will inject. To activate it, you pull off the blue cap. It's armed and ready to go. What you do, take it by the outer part of the lateral thigh, take a small swing, and inject. Hold the EpiPen for about 10 seconds. After 10 seconds, you may remove the EpiPen, and this guards the needle so there is no sharps. After a person has received self-injectable adrenaline, save the EpiPen so that it can be taken to the hospital with the patient. After the epinephrine has been administered, emergency medical services need to be contacted and the patient transported to the hospital. Even if the symptoms subside, it's important that immediate follow-up be carried through. The individual must be evaluated by a physician, in particular due to the risk of what we call biphasic reaction or a delayed reaction. So this slide shows a school anaphylaxis protocol that can be used at your school. This one is currently being used by the Bozeman Public Schools. First, the anaphylaxis symptoms need to be recognized immediately. The question that is then asked is, does this person have a known allergy? If they do, the anaphylaxis action plan for this student or person should be available and followed. Their specific individual action plan may have details that are necessary for that particular patient. After the epinephrine is given, 911 is called, and the patient transported to the nearest hospital. Again, even if symptoms have resolved. Now let's back up. If the person who is having allergy symptoms does not have a known allergy, and this could be another student, a visitor, or another school personnel, then this should be addressed immediately. In this case, it would be important to determine the correct dose of epinephrine based on weight, administer the epinephrine into the thigh, as previously shown, and then do the basic ABCs. Monitor the airway, the breathing, and circulation. Start CPR if needed. Call 911. Delegate someone to call the school nurse if they're not immediately available, and the administrator. And finally, delegate someone to call the parents or guardian. Once this initial treatment has begun, it would be important to continue to monitor the patient. And then, if necessary, a repeat dose of epinephrine can be given 5 to 15 minutes later. Stay with the patient. Provide emergency medical service personnel with the used EpiPen or EpiPens or AviQ. Make sure the parents are notified that it is important to have follow-up with the physician immediately and long-term. Complete incident forms as necessary. And finally, order a replacement epinephrine autoinjector. Just as if the patient had an anaphylaxis action plan, the patient who did not have one should also be treated immediately in the emergency room for evaluation and treatment of a biphasic or late reaction. So does your school have self-injectable epinephrine? Is there an EpiPen or AviQ available there? If not, there is a program which is sponsored by Mylan Specialty, the makers of EpiPen and EpiPen Junior. This program offers 4 free EpiPen or EpiPen Junior auto-injectors to public or private kindergarten, elementary, middle, and high schools in the United States. The only qualification is to have a valid prescription. Your physician or nurse practitioner or physician's assistant can prescribe this epinephrine as EpiPen for the school. The products that are available are the EpiPen 2-pack, the EpiPen Junior 2-pack, or you can get 1 2-pack of each kind. Again, this is a complimentary program offered by Mylan. There are some misconceptions about the use of epinephrine. Many people are afraid to administer it for fear of injuring the child or adult. It's important to know that epinephrine will not injure the patient. It works quickly, it does what it's supposed to do, and then the good effect resolves actually fairly quickly. Do not be afraid to use epinephrine. Also, rest assured that epinephrine will not be used as a drug of abuse. In addition, there are resources that may be helpful. To review this program, please go to the website of the Department of Public Health and Human Services as noted below. Also, to view this Montana law, the website is available here to see all the details. Thank you.